In cardiovascular genetics, genetic testing is indicated in a child who has a form of congenital heart disease that is highly suggestive of a genetic diagnosis. There are certain forms that are more likely to run in families. Or in a child who has a more complex presentation, so in addition to their heart issues, they may also have developmental issues or other major medical problems that would suggest a genetic diagnosis. We also think about genetic testing in someone who has a strong family history of heart issues that would suggest it's being passed down in generations in a family.
The ideal age for genetic testing really depends on each specific patient and the reason that testing is being done. For patients that come to us and they have a clinical diagnosis or they have features of a heart condition, testing might be recommended at that time because understanding the underlying genetic cause for somebody's condition can help provide information for their doctors about the best way to manage them moving forward. In other scenarios, children may come to us because there is a family history of a genetic heart condition. They are asymptomatic themselves, but they want to learn about whether or not they inherited that risk for the family heart condition. In those cases, if the condition may not develop until later in life or adulthood, we may recommend waiting until a child is old enough to participate in the decision-making process for genetic testing to make sure that they fully understand the implications of testing before proceeding. When we think about genetic testing in cardiovascular genetics, there are two main categories that we think of, and that's diagnostic and predictive testing. When a child comes to us and they have clinical features or a clinical diagnosis of a heart condition, we want to do genetic testing to determine if we can find the genetic cause for their condition. When we talk about predictive testing for children, usually they come to us and are asymptomatic, so they have no features, but there is a known family history of a heart condition and a known genetic cause of that heart condition. So genetic testing in those circumstances is done to see whether or not that child has inherited that genetic change and therefore is at risk to develop the heart condition seen in the family. Once we get the results of genetic testing, it has to be interpreted for each individual patient, taking into account their personal history, their family history, and the reason for genetic testing. Once we get results and taking all of that into consideration, we're able to determine what is the most appropriate follow-up for that individual. How frequently should they be followed by doctors? What evaluations need to be done? And if genetic testing is uninformative, if there's any additional genetic testing that should be considered. Sometimes genetic testing can't identify a genetic cause. There are a lot of advances that have been made in cardiovascular genetics over the years and the decades, but there are still a lot of unknowns. So even though research currently is trying to narrow those gaps in our understanding, genetic testing can't always provide the answers that we're looking for. Genetic test results can be used to help for family planning. Once a genetic change is identified in a child or in a family, that informs us about how that condition may be inherited in the family and what the chances are other relatives might be affected or the chances that it could happen again in any future pregnancies. At the Center for Cardiovascular Genetics, we always investigate whether or not genetic testing will be covered by insurance before obtaining a sample. So the first part of that process is to make sure that a child has a genetic evaluation at our center to determine the most medically appropriate genetic test or medically necessary test. Once that's established, we submit an authorization request to your insurance. From there, the insurance can either approve or deny the genetic testing. If genetic testing is denied, there are various avenues that we can try in order to try to overturn that denial. Once an authorization is obtained, we communicate to families if there's any out-of-pocket cost associated with that testing. We want to make sure that families are comfortable with the plan before obtaining a sample. And ultimately, if families decide that associated out-of-pocket costs are not something that they're comfortable with, there's no obligation to proceed.